Hi everyone, I wanted to give you an update. It's been a little while on my knee replacement surgery recovery. I'm still in very intense pain. This has been a nightmare of a couple weeks. I'm having issues with my surgery team getting my prescriptions of painkillers on time. Last week I called in 30 minutes late and they postponed, wouldn't give me my script until the following Monday, knowing that I'd been on oxycodone for 7 months leading up to the surgery and upped it to 20 milligrams per their approval when I first started after surgery. So I've been on 20 milligrams every 4 to 6 hours, closer to 4 hours, for 3 weeks, a little over 3 weeks now. So I had to go to the ER, which was a real pain in the ass because the ER did not want to help. The young lady doctor at the ER, which she was very nice, and I know she's just trying to do her job, gave me a speech on how opiates kill people, but pain doesn't kill people. And I have to beg to differ. Pain takes away your life. It kills your chance at gaining back mobility if you're in pain and you can't do your exercises, which I have not been able to do and not been doing, admittedly, like I should, because of the pain that I've been in. So, and then a lot of people do get in such intense pain that they do desperate things that unfortunately does take away their life. I'm bipolar. On the depressive side, so it's very dangerous for me to go through such physical turmoil and such mental turmoil with this pain. And so they tell me after that incident, they're like, hey, just call it in as soon as you pick it up and we'll make sure that it's ready and it'll never be late that way. Well, so we did that. Not a problem. Well, I even stretched it. I started taking it every 5 hours, in which I'm counting down time as soon as it wears off at about the 3.5 hour mark. And I stretch it to where I have a full day's extras worth. And then I call to see if my script's there, and it's not there at the pharmacy. So I call up there to my surgery team, and they still haven't approved it or sent it in. They say they're going to. Okay. My wife ends up calling back the next day and tries to get it sent through. And this time the nurse tells me that she wants me to start taking my tramadol every 3 hours and my oxycodone every 6 hours and only take 10 milligrams. I pleaded with her on the phone and explained to her that that's not going to work with the tolerance that I've built and the extreme pain that I'm in. Then I went to my regular primary doctor, and she agreed with me. She said, call them and tell them. And so I just kept taking them like I should, like the doctor prescribed them and like the bottle instructions say that I should, because I cannot suffer, and I just can't do it. And the pain that I'm still in won't allow me to do it. So here we are on the 5th day, which my script is supposed to last 3 days. So I stretched it a whole 2 days. Stretched it an extra day, and I had an extra dose and a half left this morning. I took 1 dose, I waited till afternoon, stretched it till I was in tremendous frickin' pain again. Took half a dose, it didn't do anything to touch it. Took my tramadol while I waited, and almost 4:30 this evening, closer to 5 o'clock this evening, into the day after I've suffered all damn day again, then I get my script again. I called the liaison, what do you call it? The people that would get me an advocate at the facility in which I'm being treated, which I should have known. How am I supposed to get an advocate through the people that are taking care of me? And they didn't even call me back, even though I pleaded on a voicemail for 6 minutes. I left a 6-minute message on the verge of tears. I was so stressed out and in such pain, and explained to them what was going on and that I was bipolar and is in extreme pain and we couldn't do this. Never called me back. So now I've got my script again. I've managed to somewhat get on top of the pain, because once you get behind the pain, it's hard to get on top of it again. I'm sitting here after my regular dose a few hours ago, and I am in extreme pain. It's going to be a long night again. I don't. A lot of people experience hardly no pain right after the surgery. A lot of people have pain even up to 5, 6 months. Some people 2 months. Some people at the 6 week mark. Some people at the 3 week mark. There is no magic number for it. My main problem going into the surgery was a patella problem, which is my kneecap, which is the worst and most extreme knee injury type injury you can have. Mine was grinding on my bone itself, and there were broken pieces of cartilage under it. It felt like glass because that's how it was acting. It was like glass or rock shredding into my tendons and my nerves. And then, of course, with the surgery, it causes nerve damage. You're cutting into nerves, you're cutting into tendons, and I'm in extreme pain. And I am at the point where I'm not trying to deter anyone from getting themselves fixed, and I don't know if I did have a choice going into this or if I should have just waited this out another few years and just dealt with the pain I was in. But I wanted my life back, and this isn't giving me my life back. This is putting me in more pain, and I'm finding it hard to be positive. I'm finding it hard to stay on track. I'm finding it hard to try it all. For the last, I'd say, week, I just want to lay in bed and give up. I haven't, of course, but I want to, because this is horrible, and I regret doing this. I regret doing this so much, and I'm hoping that that changes. But I'm at the point where I looked up some of the rights that I have as a patient and what they're doing with my prescription. They can be found legally liable for, and I'm going to consult someone. I've talked to my therapist. I have a bipolar therapist. I've talked to her. I've documented phone calls that I've made to them. My wife has been my advocate and been fighting for me. It causes her stress too, because she tries to go by what they say, and they keep switching up mixed signals. Like, one of them is trying to cut me down to a dose that will not even begin to handle the pain. The others are telling me to shorten my time and therefore take more. Other people are telling me to do what's on the bottle. None of these people are on the same page, and they are causing me a lot of turmoil. But anyway, that's where I'm at. Sorry for the complaining. I just want to be transparent and be real with you. I'll show you what my knee's looking like. I still have swelling, of course, and my bandage is starting to come off. The bandage looks kind of gross, but don't. That's just because it collects moisture and everything else, and it's lint off my pants and things like that. But it should be completely off soon. Here you go. Like I said, I'm still got a considerable amount of pain. I also have some clunkiness in there to where it feels like it's catching and it feels like it's clicking when you push down on it, and it's audibly clicking. And I've told them this too, and it could be a sign of a major issue. I've told them that I'm in more intense pain than I was 2 weeks ago, and that's supposed to be a sign that they do something too. Like I said, I am not happy with this. I'm not happy with the outcome of this so far at all. But that's where we are at a little over 3 weeks. And anyway, there's an update. Take care of yourselves, please, because if you don't take care of yourselves, you can't take care of anyone else or be there for anyone else. Self-care is very important, and please take care of each other because we're all we got. Thank you.